The first question I have is, will the vaccines still be effective with the new COVID variants?
Yeah, so I could jump in, and Dr. Quimby, you can jump in as well. There's multiple different COVID variants, the UK variant that we know about, the Brazil, the South African, and also the California variant. In Omaha, we have so far, what we are hearing is we have seen the UK variant in one person, and then we have had multiple California variants. So what we're hearing is the vaccines that are currently in play, Pfizer, Mederna, they work well for the UK variant. So yes, it will work towards the UK variant. I don't know how I have data about the California variant, Dr. Quimby. Do you have additional?
To my knowledge, there's not a lot of data on that yet. The ones that have been best studied are South Africa and incidentally, some of the ones in South America, Brazil and UK. The Johnson & Johnson vaccine is just as good at preventing severe illness in any of the variants. The Moderna and Pfizer seems to still be as effective in laboratory testing against other variants, but we don't have as much clinical data for those as we do for the Johnson & Johnson one, just because their main trials were done before those were very much circulating.
And I think you might have just answered this, Dr. B. Sorry if I'm echoing, I'm sorry. How many variants of COVID-19 are we seeing right now in Nebraska?
Yeah, so far what we have seen in Nebraska as they're looking for the variants is the UK variant. So we have had one patient, I believe, that was diagnosed with the UK variant and about 7 cases of the California variant. There's a really nice website on CDC where they're reporting all the variants that are coming out of different states. So I just looked at it. So still, for Nebraska, we have had 1 UK variant cases and no Brazil variant or South African variant yet detected here.
Yeah. You need to keep in mind, though, that not everybody who is infected has their virus sequenced to see exactly if they have the main population variant or a subvariant or even something new. We are increasing in the state how many things are being tested, but not every person with a positive swab has it tested to see what kind of genome the virus has.
Yeah, that's a really good point that Dr. Quimby brings, is that, we are testing some samples, but not all for the variant. So that's something to keep in back of our mind.
Do you know what variants are most common? Maybe, I know you mentioned the ones that we've seen here in Nebraska, but which ones are most common or popping up the most around us?
Yeah, so the first variant that started circulating in the US and that we're seeing a lot more of it right now across more than 40 states is the UK variant. So depending how the virus, the variant doubles this infection, and we could see more and more of that in Nebraska. So I think that's why, back to what can help keep it away, is that non-pharmaceutical plus the vaccine. So it's going to be really important, if the variant is circulating, possibly by end of March, early April, you could see more of those variants in Nebraska. So it's going to be really important to continue wearing the mask and getting the vaccine when it's our turn. The key is, when you could bring the infection rate down, the virus doesn't have time to mutate or spread. So that's why masking and vaccine is going to be really important.
With so many variants being found, what is the likelihood that COVID-19 will be treated like the flu, with new vaccines being required each year to keep up with the variants?
Me? Okay. Really? We don't know. From what we know now, the first go of the vaccines seem to have fair efficacy against things that are running around now, but we don't even really know how long vaccination is going to last and be protective because we haven't had enough time to assess that yet. Dr. Vivekanandan and myself were some of the first ones to actually end up getting vaccine because we were in a study trial. And I'm only about 7 months into my vaccination, and I just donated a lot of blood, presumably for them to check what my antibody levels are. But we're going to need to have more time to pass to know how long this lasts. The good thing with at least mRNA vaccines is the companies that do it say they can make substitutions and get new things out fairly quickly. So if things do need to be changed, that can hopefully be done in a rapid fashion. But we honestly don't know at this point how long even non-variant immunity would last.
I think the thing to remember also with that is that most likely we are protected for maybe a year, but myself and Dr. Quimby, like as we are in a study, we're going to be followed for up to 2 years. And whenever we go to our study visit, they're taking a lot of blood. So basically they're checking for most likely our antibody levels. So we will know more, if our antibodies are good for 2 years, will it be good for 4 years? So more to follow. We don't know that answer just yet.
Yeah, not all vaccines are the same. For example, your flu vaccine, it's pretty much a yearly thing. Something like a yellow fever vaccine, that's felt to be good for about 10 years. So different vaccines do provide different lengths of time.
When someone gets COVID-19 tested, will the test tell you if it's COVID-19 or a variant, or how are we able to tell?
Yeah, so the PCR test for COVID-19 will detect COVID-19 if it's variant or non-variant. But the actual test cannot differentiate, is it the old strain or the new strain? In order for us to know if it's one of the newer variants, it has to be then sequenced specially in a different lab. So, our current PCR testing will pick it up, but it cannot tell us which strain or so further testing needs to be done. So what's happening right now is they're taking some of the testing that is happening in our community and taking samples and looking for that strain, multiple strains in a different test, if that answers the question.
I don't know if you can answer. Oh, sorry, go ahead, Doctor.
I was just going to say that it's not all entirely random. Some of the ones that are tested are just random positive tests. But if your provider has a concern that this could be a new variant or something because there's a particular outbreak, or somebody might have had infection before, or somebody's already had a vaccine, then they can speak to the labs and have it sent off, that particular sample sent off to the National Public Health Lab for sequencing.
That's a really good point. DHHS sent out HAN alert last week just about this topic, about how if a provider has high suspicion for the variant, how to send the sample to our National Public Health Lab.
This is kind of a follow-up question, and I'm not sure you can answer it since this would probably be the lab, but how many samples are being tested, or how do you decide which ones to sequence?
Yeah, I'm not sure how many samples they're testing, unfortunately. It'll be a good question for MPHL lab.
And this is another follow-up. Is there a possibility that we have more variants than what has been reported, since not all tests are being looked at for variances?
Mm-hmm.
Possible, yeah.
Yes.
Do we know if these variants are more contagious?
Yeah, there are some studies, data that shows the UK variant is more infectious, 50% more than the variant that we have had so far. So that is why one of the big push for, infectious disease doctors like us is that we continue to wear the mask always, and also making sure we get the vaccine when it's our turn, because yes, it is more contagious, infectious, about 50% more.
Yeah, and really, even as vaccines are rolling out and everything, until enough people are vaccinated, masks are still important. I know our case numbers have gone down a whole lot, but for example, this morning, I stopped at a gas station convenience store because I needed to buy something as I was driving. there were 2 employees, 2 customers, and myself in the store, and I was the only one wearing a mask. So pandemic's not gone, pandemic's not done with us, even if we're kind of done with having it, and behaviors such as that will just make it drag on longer.
You guys are always a step ahead. The next question is, do we need to put more precautions and restrictions back in place in the state because of the variants? Are they likely to increase the number of overall cases?
I think it's just going to be really important, all of us continuing to give the message about wearing a mask. I think it's going to be very important all across Nebraska. Continue to wear a mask. You know, you don't have to wear a mask in your own home when you're with your immediate family that you live with, but outside of that, you know, you should be wearing a mask. You know, even if you're vaccinated, you should be wearing a mask, because we don't know if you could be a carrier, get exposed, be a carrier, and give it to somebody else. So I think the masking is going to be extremely important to keep, if there is a variant, now that we already see the UK variant in Nebraska. You know, as we look at the doubling time and the infection rate, we could predict most likely end of March, early April, this could become a dominant strain. But the good news is, you know, when the turn, we should get vaccinated and just continue to wear that mask so we can keep the infection rate low.
Are the variant symptoms the same as COVID-19 symptoms?
Yes.
It's still, the variants are still considered COVID-19, correct? They're just different strains.
Yes.
Okay.
Yeah. It's same virus, it's just a little bit of change.
And that's typical with a lot of different viruses, correct?
Yes. Yes.
Okay. I'm trying to get, we have some questions about Johnson & Johnson, but I'm trying to ask the rest of them about the variants. How do you overcome the continuous spread of COVID-19 and development of variants when there are still many people who are unwilling to get vaccinated?
I think, you know, just slow process. You know, that's why it's really important all of us continue to speak about our experience and then build confidence in the COVID-19 vaccine. The vaccines are great. It has been studied in over 70,000 people in Pfizer and Mederna, and Johnson & Johnson vaccine has been studied in over 40,000 people. So I think we just need to speak to the science and also make sure we have community leaders speaking to the vaccine, the importance of the vaccine, and we just got to keep that message going, because we have to reach herd immunity. So we have to get about 80 to 85% of Nebraskans vaccinated.
Yeah. And at this point, there are people who are hesitant to get a vaccine for whatever their personal health reasons are, and those can be addressed by their own providers and education. But right now we have more people wanting vaccine than we actually have vaccine. So that is, personal hesitancy will be a stumbling block, but right now it is not the large stumbling block. And people who have hesitancy about it because not enough people have had it or whatever, some of that might melt away after half the population's been vaccinated. They might see that there isn't an issue.
And also now we have another vaccine that's going to be a player, Johnson & Johnson. So if anybody wanted a different type of vaccine, now you have a third option. So I think that really helps create more vaccine for people to be able to get vaccinated.
Last question on the variant before we move on to the Johnson & Johnson questions. If you've had COVID before, can you catch it again with a different variant or because of a different variant? Would your antibodies still work if you've had one variant versus another?
Short answer is, if you have had COVID before, yes, some people can catch it again. For example, in all of the vaccine studies that were performed, as part of the enrollment, they did get blood samples to look for antibodies because they wanted the vaccine to be tested on people who hadn't been infected before. And for example, just because I have it up here, in the Johnson & Johnson one, of the people tested, a little over 4,100 people were seropositive at study entry, which means they had evidence of having infection before. And there were a handful of cases that were moderate to severe a couple of weeks after the vaccine. So it's not common to get repeat infections, but it is possible, even if you're not necessarily dealing with a different variant.
Let's talk about the Johnson vaccine. How is this vaccine different than Moderna or Pfizer, and why does it only need one dose?
Yeah, so Dr. Quimby, you could help me as well. So Johnson & Johnson vaccine, the mode of delivery is different. So they have taken a virus that we know, adenovirus, that causes common cold, and they inactivated that virus, and they have included COVID-19 virus information in there. So not the actual virus, just a little bit of information. So then when you inject the vaccine, then you're just like, you know, Pfizer and Mederna, this takes the message in, and then your body starts making antibodies, recognizes this new thing and starts making antibodies to protect you in the future. So it's just a different mechanism of getting your immune system to react and start making antibodies.
Yeah, the point of any of the vaccines is to get the outer, say, spike protein of the coronavirus in your body, but not actually part of a live virus that can make you sick. So the mRNA vaccines, they give instructions for your body to make spike protein. So your body's doing the heavy lifting there, making all the protein. For the Johnson & Johnson one, it's a virus that's grown up in the lab, but can't copy itself inside you. So it already has the protein on the surface. So you basically do a deposit of that protein in you. So your body's not making it, but it's still a foreign protein because it was injected there. Neither one can make you sick.
Should people choose Moderna or Pfizer over Johnson & Johnson because it's less effective at preventing infection? So for example, maybe people who have you know, pre-existing conditions or are higher risk for the virus, should they choose Moderna or Pfizer over Johnson & Johnson?
So we still have to wait for the emergency use authorization document to come from Johnson & Johnson vaccine. So there's still more information to come out. But the thing to remember is what we want to prevent is severe infection, hospitalization, and deaths. And both in Johnson & Johnson, in Mederna and Pfizer, there were 0 deaths related to the you know, COVID-19 if you had the vaccine. So that's very impressive. And also in Johnson & Johnson vaccine, it's over 85% preventing serious infection. So that's still very, very good. And thirdly, Johnson & Johnson vaccine is just one vaccine. It can be stored at a different temperature. So it makes it really easy for us to get it to a lot of people if it's harder for them to come to an area where you could store it at this, you know, temperature, freezer. So this is much easier to deliver, faster to give, just one vaccine. And in 28 days, you have really good antibody levels. So in my mind, if you have whichever vaccine you get, I think you should take, because that's going to help you with your immune and building up immune antibodies. And
one thing that's not necessarily fair is to pull out and say, well, this number from Johnson & Johnson, 67%, and this number from Pfizer, BioNTech, or Moderna, 94%. Because there were different populations that were being studied at the time. The Johnson & Johnson was done later when there were perhaps more transmissible variants. Okay, so that could impact how many total people had an infection. But it was still very good at preventing serious illness, hospitalizations, and deaths. I read someone say, and I'm sorry, I don't remember who to give credit to, but the right vaccine for you is the one that is available when your name comes up.
You guys just kind of answered this, but would you add anything to this question?
Sorry, Taylor,
can you hear me now?
Repeat that? Yes, go ahead.
Okay, sorry about that. In what ways could the Johnson & Johnson vaccine be more beneficial because it's only one dose and is more flexible in regard to storage and handling procedures? I know you touched on that, Dr. V. Is there anything else that you would add about the convenience of this vaccine?
I think the convenience is we could get it to rural areas, It doesn't have to be specialized, freezers. Not everybody has them, and it's one-time vaccine, so it makes it easier. A lot of time people have a lot of comorbidities. It's really hard for them to come back. So it's one-time vaccine. It's effective. So I think it has a lot of benefits that way.
Logistically, a single shot is a whole lot easier than having to schedule people to come back at a certain time, not knowing if you're going to have the supply when they're coming back for the second time. And COVID vaccination is nothing like this yet, so don't go running with this. But for example, flu vaccines, people often receive them when they're in the hospital for another reason, because it's a single shot. Once there is adequate supply, something like that could be considered, because you don't have to worry about where somebody's going to be 3 or 4 weeks from now.
What kind of data is there on Johnson & Johnson's side effects?
There is a 67-page document that you can plow through, but I took the highlights out of it, and what I found is 39% of people had headache, 23.7% of placebo recipients had headache, 38% had fatigue, 21.5% of placebo people had fatigue, 33% had muscle pain, 12.7% placebo people had muscle pain, 9% of people had fever, and the placebo recipients 0.6% had fever.
So taking away from that, I think the pain at the injection site, and also you might have some headaches and may have some fever.
There were very few what were considered severe adverse reactions.
Is this vaccine safe for people who are pregnant or breastfeeding?
For now, I am assuming it's going to be safe, but I would like to wait until we get the emergency use authorization from FDA.
Yes, looking through the preliminary documents, it wasn't tested in very many pregnant individuals. This type of vaccine has been used in pregnant individuals before, but this particular one has not been tested.
Usually in pregnant individuals, for example, like shingles vaccine or chickenpox vaccine, live viruses, we don't give vaccines. But for me, it's an inactivated adenovirus vaccine that stimulates your antibodies. So I don't think there will be any issues with pregnancy lactating, but we would probably need to wait for the official report from FDA.
Do you think having a third vaccine in the mix, that has emergency use authorization is a game changer in terms of our vaccine rollout? Can you speak to kind of what this will do in our efforts?
I think this is really, really good news to have a third vaccine, because we need to get more people vaccinated, especially, like as we're talking about the variants. The more we vaccinate people and the more we reduce the infection, the less chance the virus can mutate and for us to have another outbreak. So it's going to be really important to vaccinate as many, people in the community as possible, so that we keep the infection rate down and we don't let the virus continue to mutate. So yes, I think it's a big game changer.
Also, the more people who get vaccinated, the sooner that other activities can start coming back. For example, in my community, in the Papillion School District, my child has been going to in-person school. In various places around the country, there is still not in-person school going on because of concerns about infection transmission. So these kids have been out of school, in-person school, for over a year now. And some of them are not doing well academically. I read one article about a fairly significant percentage seem to have not had even any remote schooling in the past calendar year. And we don't want to leave a generation of kids behind. There are mental health issues with not being around their peer groups. So the more people that can get vaccinated, the faster, the better.
And the last question that I have, if your whole family or friend group is vaccinated, is it then safe to start gathering?
So if you have a vaccinated, let's say, friend group, or I think it's okay to gather, but you still have to wear your mask. So, you know, if you have 5 friends that are going to gather and all 5 have had vaccinated, I think you should still wear your mask, because if one of you are a carrier, we still don't know about the carrier state and having the vaccine. You could then give it to all your other friends, and now they could go and give it to others who have not been vaccinated. So I think it's okay to gather if you use social distancing and continue to wear a mask so you don't spread.
Yeah, the Johnson & Johnson trial has some very early data that I'm only mentioning because it's been out there and publicized a bit about asymptomatic infections in people who got the vaccine. When they were doing the statistical analysis, they wanted to wait until at least 15,000 people had enough serology data over time, and 6 months of data for asymptomatic only infection, but they're nowhere near those numbers yet. So it could be wrong. It seems that at least that vaccination does cut down on the risk of asymptomatic infection too. But again, the number of people they have that numbers on isn't enough power to say that's true. If we get evidence that vaccines can prevent a lot of asymptomatic infection, it's very difficult to spread a virus you don't have. So then we could say it's safer to, okay, meet with more people. But right now, everything is way too preliminary to say that.
Do either of you guys have any closing thoughts you want to share before we wrap up today?
Yeah, my closing thought is please get your vaccine when it's your turn, whichever vaccine is offered to you for COVID-19. And we really, really have to continue to wear masking so that, you know, as we are starting to see 1 or 2 cases of the variant, we have to keep the variant cases down. So wearing a mask, hand hygiene, and social distancing is going to be extremely important. Dr. Quimby?
My closing thought is we've had 1 large surge here in the Nebraska and Omaha area. Other places in the country have had several surges, so we can probably take some lessons from them. We got our surge to go down with improved behaviors, so now is not the time to start cutting back on that and slacking back on that, even if we're tired of it. Because if we can just hang on and keep doing this until we have enough people vaccinated, and the vaccines are coming and they are being given every day, then we can decrease the chance of having a surge and more people ill and loved ones pass away.
Thank you both so much for taking the time, as always, and answering all of the questions. Again, I'll send a link to this recording here shortly as soon as it comes to my inbox. And if you guys need anything else, please just send me an email and we'll get you what you need. So thank you and have a good rest of your day.
Thank you, everyone.